Occupational English Test. Listening Test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a doctor talking to a new patient. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, how are you feeling today?
I'm not feeling too good, doctor.
I'm sorry to hear that. Can you tell me your name and age, please?
My name is Jane and I'm 45 years old.
Okay, Jane. What brings you to the hospital today?
I have been having some unusual symptoms lately, such as difficulty swallowing, joint pain, and skin tightening.
Can you tell me more about the timeline of your symptoms and how they have progressed?
Sure, I first noticed the difficulty swallowing about 6 months ago, and it has been gradually getting worse since then. The joint pain started about 3 months ago and has been getting progressively worse. The skin tightening started about a month ago, and that's when I decided to come see you.
I see. Do you have any past medical history?
Yes, I have asthma, high blood pressure, and type 2 diabetes.
Thank you for letting me know. What about your family history? Do you have any relatives with illnesses?
My mother had breast cancer, and my father had a stroke.
Thank you for sharing that information. Do you have any allergies?
Yes, I'm allergic to nuts.
Noted. Now, let me perform a physical examination. I will need to take your vital signs. Your blood pressure is 140/90, your heart rate is 85 beats per minute, and your respiratory rate is 18 breaths per minute.
Okay, thank you.
Based on your symptoms and physical examination, I suspect that you may have scleroderma. I will need to run some tests to confirm the diagnosis, such as blood tests, imaging, and possibly a biopsy.
Okay.
As for nursing management, we will need to closely monitor your symptoms and provide supportive care. Medications may include immunosuppressants and corticosteroids. I will give you the doses to take.
Okay.
Your discharge plan will depend on the severity of your symptoms and the effectiveness of treatment. I will schedule a follow-up appointment to assess your progress and adjust your treatment plan as necessary.
Okay, thank you for explaining that to me. Can you tell me more about scleroderma and how it's treated?
Scleroderma is a rare autoimmune disease that affects the connective tissues in your body. It causes your skin and organs to become stiff and hard. There are 2 main types of scleroderma, localized and systemic. Localized scleroderma only affects the skin, while systemic scleroderma can affect the internal organs as well. The exact cause of scleroderma is unknown, but it's thought to be triggered by a combination of genetic and environmental factors. As for treatment, the goal is to manage your symptoms and slow down the progression of the disease. Immunosuppressants and corticosteroids can help reduce inflammation and slow down the immune response that's attacking your tissues. Other medications that may be prescribed include vasodilators to improve blood flow and medications to manage your joint pain.
That's helpful to know. What kind of imaging tests will I need to undergo?
We will likely perform a chest X-ray to check for any lung involvement, as scleroderma can affect the lungs. We may also perform a CT scan or MRI to get a better look at your organs and tissues.
Okay. Will I need to make any lifestyle changes to manage my condition?
Yes, it's important to avoid triggers that can worsen your symptoms, such as cold temperatures, stress, and smoking. You may also need to make changes to your diet and exercise routine to manage your blood pressure and blood sugar levels. We'll work with you to develop a personalized plan based on your needs.
That makes sense. How long will it take for me to start feeling better?
It's hard to say for sure, as everyone's experience with scleroderma is different. Some patients may start feeling better after a few weeks of treatment, while others may take longer to see improvement. It's important to be patient and continue to follow your treatment plan to give yourself the best chance of managing your symptoms.
Okay, thank you for all the information. I appreciate your help.
Of course, Jane. Please don't hesitate to reach out if you have any other questions or concerns. We're here to support you throughout your treatment.
Now, look at the notes for Extract 2. Extract 2. Questions 13 to 24. You hear a consultation in GP's office. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, may I know your name please?
Hi, my name is Sarah.
Hi Sarah, can you tell me your age?
Yes, I'm 35 years old.
What brings you to the hospital today?
I'm experiencing swelling in my arms and legs.
Okay, can you tell me when you first noticed the swelling and how it has progressed?
It started about 6 months ago and has slowly been getting worse.
Thank you for that information. Do you have any past medical history?
Yes, I have a history of hypertension and hypothyroidism.
And how about your family history? Has anyone in your family been diagnosed with any illnesses?
My father has diabetes and my maternal grandmother had breast cancer.
Thank you for that information. Now, do you have any allergies?
Yes, I'm allergic to pollen.
Thank you for letting me know. Now, let me do a physical examination. Your blood pressure is 130/80, heart rate is 80 beats per minute, and your temperature is 98.6 degrees Fahrenheit. I will need to order some investigations to confirm my diagnosis, but based on your symptoms and physical examination, I suspect you have lymphedema.
What is that?
Lymphedema is a condition where excess fluid accumulates in the tissues, causing swelling. We will need to run some tests to confirm the diagnosis, but in the meantime, we can start you on some nursing management and medications to help with your symptoms.
What kind of medications and nursing management?
We will start you on some diuretics to help remove the excess fluid from your body, and we will need to bandage the affected areas to help reduce the swelling. You will also need to elevate your legs whenever possible and avoid sitting or standing for long periods of time. As for discharge, we will need to monitor your progress and adjust your medications accordingly.
Thank you, doctor. Can you tell me more about lymphedema? Is it a serious condition?
Lymphedema can range from mild to severe, and it can be a chronic condition. It occurs when the lymphatic system, which helps to remove excess fluid and waste products from the body, is not functioning properly. There are two types of lymphedema, primary and secondary. Primary lymphedema is caused by an inherited abnormality in the lymphatic system, while secondary lymphedema is caused by damage to the lymphatic system due to surgery, radiation, infection, or trauma.
How is lymphedema treated?
The treatment for lymphedema involves reducing the swelling and managing the underlying condition. In addition to diuretics and bandaging, we may also recommend manual lymphatic drainage, which is a type of massage that helps to move the excess fluid out of the affected area. We may also recommend compression garments, which help to keep the fluid from building up again. In some cases, surgery may be necessary to remove excess tissue or repair damaged lymphatic vessels.
Are there any complications associated with lymphedema?
Yes, there can be complications associated with lymphedema. If left untreated, the excess fluid can cause the affected area to become infected, which can lead to a more serious condition known as lymphangitis. Lymphedema can also make it more difficult for the body to fight infections and may increase the risk of cellulitis, a bacterial skin infection. It can also cause skin changes, such as thickening or hardening, which can lead to further complications.
Is there anything I can do to prevent lymphedema from getting worse?
Yes, there are some things you can do to manage lymphedema and prevent it from getting worse. Elevating your legs whenever possible and avoiding prolonged sitting or standing can help to reduce swelling. It's also important to exercise regularly, as this can help to improve circulation and reduce fluid buildup. Wearing compression garments can also help to prevent the fluid from building up again. And, of course, it's important to manage any underlying conditions, such as hypertension or hypothyroidism, that may be contributing to the lymphedema.
Thank you for explaining all of this to me, doctor. How long will it take for my symptoms to improve?
It's hard to say how long it will take for your symptoms to improve, as it will depend on the severity of your lymphedema and how well you respond to treatment. We will monitor your progress closely and adjust your treatment plan as needed. It's important to be patient and consistent with your treatment, as it may take some time to see improvement.